All right, episode 7 starts now. It's 8 o'clock on the dot. We're waiting for our guests to come on in. It's a beautiful Wednesday evening. It's been a long, strange day. Let's see. Waiting. Waiting. System's never taken this long. Telling. Boom. There we go. Instagram with the slowdown. Waiting on our guest, Dr. Roig. Dr. Roig is in the building. There we are. Dr. Roig, how are you?
I'm good. I can't see you though. Oh, there you are. Hold up. Kind of. Hold up. Hard to hear.
Hard to hear. So Dr. Roig just finished working down in Midtown, Miami. Literally, he hopped out of a room, finished up his
Oh, there you are. Hey.
and now he's with us live. How you doing, Dr. Roig?
I'm good, man. If you guys hear a workout class next door, it's it's not me. It's 8 o'clock and they're jamming. They're about to go off right now.
Hey, that's what you do in Midtown. Well,
Yeah, man.
thank you for joining us live here. This is actually episode 7, so we
Cool.
are up there in our show, and I'm glad to have you as a guest. You are definitely one of my good friends, and I had to expose the world to you. So if you could, tell the people a little bit about yourself, who you are, and what you do for a living.
All right, man. So thank you, number one, for having me on. I appreciate it. And everybody, I hope you tune in. This guy's great. He's a good friend of mine. So a little bit about me. Mike, Dr. Roig, everybody calls me. I grew up in Miami, first generation immigrant, just trying to make it in this crazy dental world, you know? And that's it. I mean, I'm a normal Miami guy. I like to fish. I like cars. I like all normal stuff. I don't know what to say.
All right, so you're a periodontist.
Yeah.
Can you tell what perio is and why you decided to become a periodontist?
Yeah, for sure, man. So perio essentially is the specialty that deals with the gums, the bone underneath, the foundation basically of the teeth, and recently dental implants. So that's usually what perio is involved in, the foundation of your mouth, the teeth.
And
So
you mentioned implants, and I know that's something you're really passionate about. And so let's imagine you have like one of our patients sitting in the chair and
yeah.
trying to about implants. Can you give me a little rundown? What would that role play look like, you and that patient?
Yeah. So essentially if someone came to me with a missing space, I'd take a look and usually what my go-to is a dental implant is a titanium screw. It's exactly the same material and makeup as any other prosthesis that you get in your body from any hip implant or elbow replacement or a knee replacement. It's the same material, but a dental implant replaces a single tooth in your mouth, essentially. So it's a screw that goes in and it takes about 3 months to heal. And after the 3 month period, then you could get a tooth on top of that implant, usually.
And so now that we're looking at, does it hurt? That's what most patients want to know. Does it
Gotcha.
hurt?
For the most part, my patients rarely take more than 2 or 3 days of medication. And at that, it's usually ibuprofen that I send them home with, and they're perfectly fine. I also have patients that tell me, you know, I call them after the procedure and they tell me, hey, doc, I haven't had to even take one of them. So it's a relatively painless procedure compared to other surgical procedures in the mouth. So I always say if pulling a tooth is a 10 on a scale from 1 to 10, a dental implant's like a 3 or a 4.
Okay, got you. And so to become a periodontist, you had to do training. And so I had to rep our residency
Ooh,
at the Montefiore scrub
repping
school.
it.
You got to. Can you tell people about your experience up in the Bronx, helping out all those great people at Monty?
Oh yeah, man. Listen, Montefiore. So Perio's the foundation of dentistry. Montefiore was my foundation as a general dentist and on my way to become a periodontist. They were probably one of the best decisions I've made in my career. And it's all because of that Dr. Newsom, who really, she was the program director there, and she really understood, you know, what I really wanted was perio. So she facilitated for me, you know, within the program itself, she facilitated for me having somebody to mentor me throughout that year-long process to, you know, in general dentistry. It's a 1-year residency in the Bronx, and it's usually specializes in more advanced hospital-based dentistry. But in my case specifically, the program director, Dr. Newsom, really guided me and made sure that I was followed by a periodontist, and that periodontist mentored me and gave me all the tools that I needed to get into perio school afterwards.
Yeah.
So that was wonderful. And on top of that, she helped me get my IV sedation certification. So I'm always grateful to her and for giving me the opportunity. Plus, I got to meet you.
Exactly, right? That's
Yeah,
definitely
man.
one of the great things, us meeting each other up there. With Dr. Newsom, she was like a mother figure, man, for everybody. She would go out of her way to ensure that, you know, her residents were taken care of. You know, things pop up nonstop when you're doing residency, and to have somebody have an open door policy like she had, definitely
Yeah.
helped. You know, from dealing with your attendings to dealing with patients, it was always good to have her to kind of like bounce ideas off of, and even talk
That
about
lady's a saint. I have no idea how she juggles so much, but I mean, to find the time to really help me out and guide me with the periodontist and have me like IV certified, I mean, incredible, that woman.
So when you were up there and you were doing all those cases, I know some of my viewers know about like all on fours and all on X's. Can you
Yeah,
talk a little about that?
absolutely. So all on four or all on X really means a prosthesis in the mouth on a certain number of implants. Okay. And that usually that style of case is reserved for, you know, for the last resort type of thing. Okay. After we exhaust all our options, and Dr. Golden is surely aware of this, he tries to save as much as he can. But let's say the patient comes in with no teeth and they say, Doc, I have trouble eating. I can't speak. You know, I'm having trouble swallowing. It's impossible. I can't wear my dentures. So for those types of patients, we have solutions, and that solution is all on four, all on six, or however many implants it takes to give the patient something retentive. Basically, it's a series of implants that go inside either the maxilla or the mandible, so the top or the bottom. And those implants, once they're integrated, once they're healed in the bone, could support a denture with clips on it in order for it to be very retentive. Now, the step up from that would be something that stays in the mouth, which is also an option. It's called a hybrid. And those hybrids are amazing because you don't have to take those out at night. They stay in your mouth permanently. And they look great. Plus, you know, the day of the surgery, we could have those placed, and you leave with a beautiful set of teeth that same day. So it's a great option, but it has to be the right patient. You know what I mean? It is selection for that type of case is key. You know, but the only way to figure that out is to get a consultation. So.
Right. It has to be the perfect patient, the right patient. For me, I like to make sure my patients are aware that, hey, this is going to be like a car. You're going to have to maintain it. After you got
Exactly.
all of those amazing implants, and then I place prosthesis, it's like you need to come in, every now and then so we can check up on this car and make sure everything is running well.
Exactly.
I like to get to the nitty gritty, Doc. What are some of the things that can happen to that prosthesis, just so that our viewers know, like, hey, it's not a one-stop shop and that's it. What
Yeah.
can, if not maintained?
Gotcha. So it's just, I always equate it to a car, just like you. If you don't get the oil changed in your car, something's going to happen. You might blow an engine. With a prosthesis, like all-on-4, all-on-6, if you don't maintain it, if you don't make sure that it's nice and clean, then you have the potential for the implants to fail. And an implant is not really going to tell you what's going on because it's not living, it's not a tooth. So you got to come into your cleanings every 3 months and have the prosthesis cleaned, have some x-rays taken. That's the only way to maintain this smoothly and running properly. To make sure that your hygiene is good, you have to take care of it at home. You have to water pick underneath it. But essentially, you could lose the prosthesis. The implant could simply lose bone and fall out.
Right.
So you got to make sure to keep it clean. Even more, I tell my patients, you got to keep it cleaner than you did when you had teeth.
Right. All right. So let's get over that gloom and doom. Let's talk about other procedures that you love to perform in the perio arena. I know there are a couple cases that you've done that have kind of blown my mind, and I like the thing about that crown lengthening case that you did for the young lady who had the really gummy smile,
Oh,
and she
yeah.
wanted to change that. Can you talk about that case?
Absolutely. So this young lady came to the office, and she was beautiful. She just got her teeth straightened at the orthodontist. She had a nice big smile, but her teeth were teeny tiny little teeth. And this happens often after you get braces where your gums kind of overgrow. And that overgrowth of gums is problematic because it's hard to keep it clean, all that overgrowth. And it happens because you had the braces on for so long and because it's so hard to clean. So the gums just get inflamed. But that's an easy fix. So this young lady came into the office. She came in for a consultation, and about an hour later, I trimmed the tissue. I gave it, I'd say, I tell my patients it's like a haircut for your gums.
Right.
So I gave it a little trim, and in a matter of 15 minutes, she looked completely different. Her smile got even bigger than it was before when she walked in.
Yep.
She was, obsessed with her smile at that point, and she had just undergone the procedure. So you sent me some photos maybe like a month later, and it looked even better. I'm impressed with how good she looked, but definitely it's one of my favorite procedures because the satisfaction that the patient feels is almost instantaneous.
It was, and she was so happy. She referred more of her friends here to the practice, and it was
Yeah.
something that was so simple, and it changed her life. So I want to say thank you so much for helping her,
Oh man,
and we have to keep doing cases like that because I love that feeling.
Man, it was only a 15-minute thing, and the transformation was incredible.
Right, right.
So
as we're going to transition, if anyone has any particular questions for Dr. Roig, please put it in the comment section so I can have him answer those. And then at the end of our program, he'll go through each of those questions, and let's see what we can get going, okay? All right, Dr. Roig, so now I'm going to switch gears. What made you go into dentistry? You got to tell everybody that. Like, what was the thing that made you say, I want to be a dentist?
Well, I mean, hold on, because I'm getting my battery's running a little low, but essentially, I loved dentistry as a kid, and that really made things a lot easier for me. I had a great experience as a child going to an amazing periodontist at Miami Children's. And ever since then, I was very comfortable. So when it came to time for college, I wanted to be some sort of physician. And I was kind of thinking to myself, what's the best, like, who do I feel comfortable with? What? And then I thought back, man, I really had a great time, at the dentist as a kid. I really liked it. I never had any issues. It was always fun. So that kind of led me into the dental field. And then once I got into dentistry, I realized, I have a passion for surgery. So I further specialized into perio because, I just wanted to do surgery and fix people's mouth and make them happy. And that was just my calling, I guess.
That's so awesome. I know something that you told me recently. You see people from all walks of life, from just the everyday person to sometimes even some superstars. Per HIPAA, you can't say that particular person's name or the other people you've seen. But what is it like when you're seeing, said celebrity?
Um, it's fun. I mean, I treat everybody normally. I treat everybody like a celebrity. So no one, even those guys that walked in, I treated them just like any other patient, and I think they appreciated that because I wasn't, fanning over
Starstruck.
them. Yeah, I was just another day, another patient. Everybody's the same for me. It's all quality of care across the board, no matter who you are. But it was fun. I mean, I did the procedure, everything went great, and then afterwards, I'm like, hey, I know who you are, and we took a photo, and there were everybody was cool about it, and but yeah, man, I enjoyed it. Celebrities
Yeah.
or the community. I love all my patients.
I knew you'd say that. And that's why my team here at West Sunrise loves you so much. I remember your first day, they were like, man, that periodontist is just, so cool, so down to earth. They enjoyed just kind of talking with you and chatting with you about cases. You didn't intimidate anybody. You were just, down to earth. I have this one picture that I didn't get to post, but you literally were working on something. You grabbed the case and you walk to the lab and you start working on the case. And like my team was blown away. Like they couldn't believe that, you walked over there and you just started doing it. And you didn't yell at somebody to go do it for you. And the
No,
fact that,
man.
you were down to earth, they love that stuff.
Yeah, man. Everybody gets busy, and as long as everybody puts in their work, I don't mind doing extra. You know, I'm about teamwork and making things happen. So the less friction we need to make something happen, that's the path I'm going to take. And being a team player is just part of that. You know what I mean? You got to move forward, and that I feel like that inspires people. You know what I mean? If the
Right.
periodontist is doing lab work, then the hygienist is going to want to join in and say, you know what, he has the time to do this. I definitely have the time to do X, Y, Z, or the dental assistant. Today
Right.
I ate lunch at 5. So, I mean, and also my assistants ate lunch at 5. But how did I get that? Because they know I work hard and I wasn't slacking. And, it's just, you lead by example. So,
I hear you. All right. So one of the questions that we have from our audience, do you feel the pressure because you're a young periodontist? Do you feel pressure because of that, Doc?
no, man,
You're
there's
too cool.
no, man, the thing is, once you go through the training that we've been through at Monty and then moving past that at the VA and at NYU, there is very little that I have not seen and I have not dealt with. So, as far as surgical procedures
Uh-oh.
go, I mean, you good?
They took the internet. Go for it, Doc. You back?
Yeah, I'm back. I've been
Okay.
here. So
Oh,
as far as surgical procedures, very little that I haven't seen. So it's easy to deal with any sort of complication if it were to arise because I've seen it, I've done it, I've dealt with it. as far as older folks, it is a little bit hard to overcome just being a young periodontist and trying to tell these people, you know, what it is that you're doing when you're the age of their grandson.
Right.
But I stick to the facts. I lay it out in a way that it's very hard for them not to understand. And I feel like that really helps kind of persuade them that you know, I'm genuine, and I'm telling them how it is, and I'm breaking it down for them, and they end up appreciating it. And it works out for me. So not usually. At the beginning, when I first got out, I grew a big giant beard and I was trying to look older, but now it's just, you know, it's
You
just
go in
me.
there, you do what you need to do. Yep.
Yeah, man. I
No.
guess they feel the confidence, but
Yeah. After you walk out of every room, man, like literally, I'll go back in and say, "Do you have any questions?" And like, "No, man. He just sold me on it. I need to do what I need to do. I've been waiting forever, and I'm glad that I found somebody like that to do the procedure." So,
yeah, man.
you know, from everybody here at West Sunrise Dentistry, I just want to thank you for all your hard work. I
Oh,
promise I
thanks,
wouldn't
man.
keep you that long because I know you have to get up early and you have another set of patients to get to.
Yeah, man.
So I'm going to leave you with this last question, all right?
All right.
If you could be anywhere in the world, because I know how much you love to travel, what's your
Yeah,
favorite place to travel in this whole, you know, beautiful planet?
man. So far, there's so many places, but I think I've had the most amazing time probably in South Africa. I went on safari out there, and it was just unbelievable. The animals, the sights, the people, the food, the views, everything. They have everything down there. It's mountains, it's wild animals, it's fine dining, it's everything. Everything you want, you could find down there. So that's one of I've only been there once, but I'd love to go again, and that's a place that I enjoyed, truly enjoyed, and I would go back.
So I saw your video on your Instagram page of you in South Africa on safari, and that definitely motivated me, and I need to get out there. I
I'll give you
definitely
my
want to go.
itinerary.
Hey, man, please do.
Anybody
So,
on this chat, if you're listening and you want a good itinerary, I got you.
again, Dot, thank you so much for joining us. Guys, I'm going to repost this for anybody who came in late. Dr. Roy, you, sir, are a blessing, and I appreciate you so much, my friend.
Thank
Um,
you so much.
let's continue to do great things here at the office.
Absolutely.
All
All right,
right.
guys.
Good night. Take
You
care.
too. Thank you. Bye.